Welcome to Heller Hurwicz Office Hours, a podcast featuring University of Minnesota affiliated economists and their research. In this special series of the podcast, we're focusing on the policy priorities of the second Trump administration and how research can inform our understanding of a rapidly changing economic environment. Recent legislative changes are projected to have a significant impact on access to health insurance coverage for the about 24 million Americans who receive coverage through the Affordable Care Act, better known as Obamacare. These changes have been a sticking point for Democrats and bubbled over into the current fight over continuing government funding. In this episode, Professor Anran will share her perspective on learnings from her recent work on preventative care investments in the individual market and how reductions in overall coverage could play out for the nation's health. So welcome.
Thank you for having me.
So I'm going to start out with the really naive questions, just very basic question. What does preventative care include?
Right, so preventive care is kind of a medical terminology, but it is very broad. So you can think of like vaccines who are preventing you from getting disease, like cancer screening who will detect the disease early on, or which make it more curable or cost less to treat. Or you can think about chronic disease management, like diabetes care, taking aspirin for heart attack disease, which will manage the disease from progress to more advanced stage. So it is really a type of medical care that will keep you healthy or slow down your disease progression.
And now there's I think it's a long literature in economics that, the basic message is individuals, people, they underinvest in their preventative care. So what are the main reasons why individuals or people may underinvest in their preventative care? Because it sure is a good thing.
Right, that's a great question. So there are a couple of reasons that the current studies have found. For example, although preventive care is good, some people may not realize the value of it, so they are undervaluing it or have a misperception of what the benefits could be. Sometimes, we have these behavioral biases. Sometimes people procrastinate to go to doctors. All those type of myopic behavior could make people not use the level of care that the doctor will want them to.
Right, and there's also cost. I was just interviewing somebody and, they had some mild condition, but they just didn't want to spend the money.
Right, exactly. Cost can also be a very important factor here.
So looking at your research, that's the demand side. And your research is looking on the supply side, the insurance companies, and what is their role in preventative care?
Right. So besides individuals actively seeking out to doctors for preventive care, actually the medical providers and the insurance side can also do something. So for example, some insurance company have this disease management program where they'll have a designated person who will be in charge of reviewing your records. They'll give you phone calls, help you schedule doctor visits that you're overdue, which kind of this type of program help you manage your health, especially you get a chronic disease that you need to see doctors regularly. As another way, some insurance company also have a doctor incentivizing program. For example, they can reward doctors, say $25 or $50 per completion of a preventive procedure for their patients. This can also incentivize the doctor, so when they're in your office, their office, they'll be checking up upon your records and telling you how valuable preventive care is, and maybe prescribe you some procedures if you're in need of one.
Now, your paper says that the insurance companies also underinvest in preventive care, but it would seem if you're an insurance company and, people are going to send you their doctor bill as their condition worsens or they get less healthy, that there would be a very strong incentive to invest in preventative care. It's not always going to work, but it would seem playing the averages, which is what insurance companies do, on average, that's a smart thing to do.
Right, exactly. So if you think about the case that I'm stuck with an insurance company, the company is going to be responsible for me over a lifetime, then of course they'll have the incentive to manage my health. Because say if I'm a diabetic patient, I didn't manage my B1C levels, blood sugar levels well, then maybe next year I'll end up in the ER, which will cost them a fortune of the bills. But on the other hand, if they try to encourage me maintaining a healthy lifestyle, get my biometrics and other like kind of measures in a good levels, then I won't be going to the ER in the next year. I won't develop all those complications, and that could save them a lot of money. So let's say under the condition that it will generate the cost savings if I'm still with the company in the future, if the procedure is beneficial for my health, and they can still recover that cost savings, insurance companies then will have the incentive to keep me healthy.
Right. So why don't they invest more? I mean, it seems fairly logical. And plus, individuals, whether it's financial or just time, you're raising kids, you got to do your job. I can kind of understand why they underinvest in preventative care. You can always put it off to tomorrow, especially if you're feeling a little bit okay. But for an insurance company, this is their business. And in the end, they're going to get a big bill or big bills. So why are they underinvesting?
That's a great question. So that is actually related to some, I would say, economic incentives or the institutions that insurance companies face. So unlike other, say, European countries, we, the United States, do not have a single payer system. Instead, we have many private payers who are competing for patients. And we also have different medical programs like Medicaid, the Individual Exchange Program, Medicare, employer-sponsored insurance that people can switch upon. So let's imagine a case that, say, I'm with insurance company A. And next year, because of my job changes, I go to company B because insurance company B is what my new employer offers. Then in this case, insurance company A will be thinking about the problem. Do I want to invest in me, Anran, this year? I spend a lot of money, encourage her to do all the healthy stuff, do the preventive care. But in the next year, she goes away. So I won't be recovering this amount of savings that she's being healthy. Instead, this part of savings she being healthy is recouped by my competitor, insurance company B, which is going to be her future insurance company. So because of this consumer going away from the current company, or in other words, when they're switching among competitors on the market, or are they switching between insurance programs like individual market, employer-sponsored market, changing payers, this really creates a disincentive for insurance company to invest in people's health.
So is it this churn in the health insurance market is the fundamental economic reason why we have this underinvestment in preventative care?
I would say that's a very important reason for the supply side incentives, right? If you think about companies being rational, they're doing this dynamic calculation, and the fact that people are going to leave them in the future is really creating this, I would say, pullback reason for them to invest.
And so now your study, you look into the Affordable Care Act exchanges. Now, why did you use the exchanges for your study as opposed to, say, you just use the example of the employer-sponsored health insurance like I have at work?
Right. So I would say for the exchange market, the churn there is very severe. So if you think about people's jobs, the employer market, it is somewhat stable that you're going to be staying with an employer for a couple of years, and the employers have incentive to also make you healthy because you're going to be more productive. But on the exchange market, this type of employee incentive also even doesn't exist. So in the exchange market, what my study have found is that every year about 30% of people will leave the current exchange market due to job changes. So they're going to be going in and out in between switching with the employee-sponsored market. And furthermore, within the 70% who remain on the market, about 50% will stay with the original payer and 20% will go to a new payer because insurance companies are competing against each other. You always want the best product, best prices, so you go to the competitor company. So the retention rate for each insurance company on the exchange segment is very low. And that makes the underinvestment problem in preventive care very severe in that market. And we did see a very big utilization gap in the medical procedures that doctors think are very valuable.
Okay, now I know this is not the right response, but okay, you can't move. You're stuck. You make your choice, and that's it.
So
I think that's probably a bad solution.
right. You're on the point, and that's where our economic modeling comes from. So you're onto the great point that if you make people not able to choose, you're killing the other competitive incentive on prices. Because if companies know that you'll always stay with me, they can charge you a super expensive prices, knowing that you're stuck there forever. And that's why we need this careful design of policies that will balance out this trying to constrain the company's pricing incentive, try to still make some competitive incentive on the market. But on the other hand, we also need to pay attention to this long-term population health issues. We need to encourage companies to invest in people's health at the same time. So there is really a tricky balance there in designing, say, the enrollment policy or any competitive policy for the individual exchange market.
So is it a regulatory response? Is it I guess a mandate would be a regulatory response, but I guess it would say a regulatory incentive response or a regulatory mandate response. I mean, how do you kind of weigh what some of the options might be?
Right, so there are a couple of options that policymakers could choose from. One is trying to extend the length of insurance products period, where we can say going from 1 year to 5 years, for example. But that, of course, has the issue that we just talked about. You're stuck there. There are other bad parts with it. Other options could be, say, mandating not only cover preventive care for their enrollees, but also reaching a utilization target. So for example, in South Carolina's Medicaid programs, they are already mandating that the private insurance company need to achieve 80% vaccine rate for children, or X% of diabetes care utilization before they can operate on the market on the next year. So that's one option. The other option is what currently Medicare Advantage is doing. So it is offering insurance company quality bonus for the high usage of preventive care. So in Medicare Advantage, the government will give star ratings based on insurance company how well they're doing in terms of their providing high quality medical care to people. And for those top performers, the government will give them some subsidies as a reward. So those are the possible two options for policymakers to consider.
And where does your model land? What in this balancing act, where does your economics model point to?
Right, so if you think about these quality bonuses and quality mandates, they also have their trade-offs. So for the bonus programs, it did give people like a big reward for providing high quality, but of course that involves with taxpayers' money. So you have to raise taxes to fund those quality bonuses. On the other hand, the mandate is kind of coming as if it is free, because government doesn't spend anything. But on the other hand, if you mandate something that is very costly for insurance company, they may be exiting the market and limiting the options that people might have. So which one is more effective really depends on, say, how effective or how responsive companies are to bonuses and how responsive they're to their mandates in terms of the exiting probability. So I put the data so what where my research comes in is I did a careful modeling of consumers' demand for preventive care and insurance companies' incentive for providing care. And I estimate all those market forces to kind of give a recommendation on which one seems to be more effective. And what comes out of the model is that this mandate on preventive care utilization, this investment mandate, seems to be most effective. So why is that? It is, so first of all, as we said, it doesn't involve raising extra money. What I'm finding is that companies are also collecting enough revenue, which I'll explain in a minute, that it is not making the exit decision. So why companies are still earning money when government is trying to put a high quality threshold on them? This is because in the long run, when you are managing people's health well, they're becoming healthier, which kind of lowers your medical bill. So if we can get every company to do that, population health improves, so companies are still earning money under that quality mandate. And that is the trick which is making the investment mandate most effective policy recommendation coming out of the model.
Because insurance companies are always worried about ending up with a pool of less healthy people, right? So what you're saying with this model is that even though there's a lot of churn, you've kind of raised people's health. So everyone's benefiting even if the individuals are different. So it's not a race to the bottom anymore.
Right, exactly. It is kind of that companies are in a prisoner's dilemma, that they are racing to the bottom. They don't want to invest in people's health because they are worried that the good enrollees, like the healthy ones, leave to their competitors, and their competitors are dumping the unhealthy ones to them. When we implement a mandate there, we're raising the bars for them so that every of the enrollees on the market becomes healthier on average. So they don't need to worry about my healthy people go away and my competitors throwing me unhealthy people, and that helps keep their profit flow and also helps to maintain their investment incentive from the mandate policy.
So how did you land on this research project, in this fragmented health insurance system that we have? How did you land on this, I guess it'd be the lens of preventative care?
So I'll give you two very real-life experiences that sparked me think on this problem. So when I was in grad school, my student insurance have a policy that tells me that if you go to the gym like almost every day or something, we'll give you like a free Apple Watch. So I was like, oh, a free Apple Watch, why don't I sign up for
Why
that?
not?
Why not?
Yeah.
And then I start to think, oh, why they're giving me free money, right? So there must be something that they're getting out of it. And then I start to realize that although they're giving me this like free Apple Watch, they make me go to the gym every day and I become healthier, which lowers the insurance bills. And on the if you think about it on net, maybe my insurance company is also gaining money by giving me this small incentive. That's the first time in the States that I start to think about this preventive care issue. And then another experience coming overseas is that I come from a country where there is a single payer system, and preventive care is really a culture there. Because the government, as the only insurer for the society, really wants to keep people healthy. They want to invest in people's health. So back home, there'll be like annual health checkups. People are encouraged to do that. It's almost a culture there. But then when I come to States, I wanted to do like a health checkup and this preventive stuff. And I started to figure that it is a little bit hard compared to my previous experiences in accessing this type of medical care. And then I start to think, maybe there's some institutional or systematic issue that creates this problem. And then I start to think about this, people turning away this segmented health insurance market, and then gradually I figured that maybe there's a paper to write about this problem.
And so where do you think you'll take this next? What's the exploration that this is going to lead to?
So I think there are still a couple of unanswered questions in this area. So now that we realize that the supply side, in addition to consumers, also play a role in kind of shaping the preventive care usage landscape. The second the question that we want to ask is, what's the most effective way to incentivize the supply side to give the appropriate care to people? So my paper touches on how the insurance company's role in that process plays. But also there are roles that you can think about, like physicians, how to design their incentive to make sure that physicians are prescribing the appropriate amount of preventive care to people. Or maybe are there any other, say, information campaigns that can raise people's awareness of how important preventive care is? There are a lot of unanswered questions in this space that I think can inform better and more effective delivery of healthcare in general and try to improve the population health.
And I don't know if this was in your data, but when you're going through the data, there's a lot of discussion right now about the level of subsidies. Should they be raised? Should they be lowered? Stay the same? As you know, this is a big part of the discussion with the government shutdown. So did the subsidies have any impact on when you're looking at the data?
Right, so that's a great question. So in fact, a lot of Americans didn't know that, speaking of preventive care, lots of procedures are free to them. So the government mandates it is zero cost sharing. It's going to be free to consumer. But according to survey statistics, 2/3 of consumers just don't know that. So they just don't go to the doctor because they think the price is going to be high. But in general, the subsidies that we are talking about on this individual market, they also play an important role. Because we know that health insurance in the United States are expensive and people are price sensitive. So if the subsidies are going to go away, it's going to raise your out-of-pocket expenses for this health insurance and the medical care in general by a lot. So lots of people might choose to go uninsured. They'll postpone their doctor visits, which can be essential for their health. And there can be some, I would say, very serious problems that we have to think about when designing these subsidy issues.
Yeah, and letting your health deteriorate, it's just not good for individuals, but it's also not good for society and the economy.
Right, so when we are thinking about this investment in people, what we really need to think about is this population health. It's not only about each individual, like each consumers being healthy, having access to medical care. It's going to raise the productivity of the society in general.
Well, I could keep going, but thank you very much for your time. This has really been informative and fascinating.
Thank you for having me. It's been fun discussing these really important healthcare issues.
Anran Lee is an economics professor at the University of Minnesota. Office Hours is a production of Matriarch Digital Media, hosted by me, Chris Farrell. Executive producer, Twyla Dang. Producer and editor, Lushik Lotusli. Music by Bob Bradley. A special thank you to Heller Hurwitz's Hannah Fairman and Janine Sorrell. Subscribe to Heller Hurwicz Office Hours to hear about the economic research being done at the University of Minnesota. And to learn more about the research we discussed today, visit hhei@umn.edu. Thanks for listening.